A memorable moment would be being able to interact with all the people and just to see like what they're going through, and also like being aware of like how much aid is provided through this place. And I feel like it's just such a heartwarming experience being able to be part of that. When Mish and I were inside the pharmacy was that a lot of the drugs which were lacking were seizure-related drugs and other mental health-related drugs. And when we spoke to the ladies about where these drugs were administered for, so the seizures, a lot of them had seizures due to schistomiasis, so from snails biting them and them getting diseases which are blood-borne, and they'd travel up to their brain and cause these seizures. And most of these people were farmers. So these farmers are hard-working people, and they would have had to have taken a long way away out from the farms just to come down for medical support. And then they reach the doctor prescribes them the medicines, and the medicines aren't available for them at an affordable price. Because other than this pharmacy, the prices at which that they're given out were not really exorbitant, but outside the range of them. And one thing about being Filipino is family and being to provide for each other. And when you think about the number one manufacturer of Bukidnon being rice, you think about how all these people are working hard in the fields to provide for not only their family, but for the community. And when it's their turn to really have this support, they're not able to really receive it because of the assets available to them. And that's one of the things that really struck me, that people really deserve to be catered for, especially if they're really catering to the community. So for me, it was absolutely heartbreaking to hear that these hardworking people weren't able to receive these. And
so he's following
instruction, the vision, the food, and then the medication.
Let's dance in style, let's dance for a while.
not every mosquito will give you the hit, but there are special mosquitoes which will make you get really, really sick. Well done. Today was the last day implementing the strategies that we had for the primary school and for the national high school. And in the morning I was part of Carlene and Bianca's team, and we worked on educating them about early sexual health and early pregnancy. And it was really eye-opening to see that a lot of the students there were really interested about the topic, but never really given the opportunity to thoroughly dive into it. And to that, I'm really grateful to be part of this team, and I hope that this has long-lasting impacts on them for the better. Mish and I had this dengue mosquito sort of presentation, which the kids really got around, and they're really getting involved acting, and it was really, really heartwarming to see them really appreciate us coming down, and we do appreciate them letting us into their lives. And I hope that they're able to share this information with others, and all in all just spread the good news about hygiene and dental health and working to eradicate dengue. And I'm really grateful for all the people here in Bukidnon, and especially in Valencia, for their hospitality and keeping us nice and safe and keeping us together, well fed and happy.